antiviral agents. Anti-HIV agents, including fusion inhibitors, reverse transcriptase inhibitors, integrase strand transfer inhibitors, and proteinase inhibitors. The anti-herpes agents include acyclovir, ganciclovir, foscarnet, and drug for influenza includes amantadine, zanamivir. The hepatitis drugs includes interferon alpha and others. Anti-HIV agents includes fusion inhibitors, reverse transcriptase inhibitors, integrase strand transfer inhibitors, proteinase inhibitors, and CCR5 antagonists. The reverse transcriptase inhibitors includes nucleotide reverse transcriptase inhibitors, non-nucleotide reverse transcriptase inhibitors. The fusion inhibitors includes amphivirtide IAM. The price is very high, so little used. Its action are due to disrupt the molecular machinery at the final stage of fusion with target cell. It prevents uninfected cells from becoming infected. The adverse events, including injection site reactions, cough, dyspnea, and joint pain. Reverse transcriptase inhibitors include nucleotide reverse transcriptase inhibitors, abacavir, ABC, didenosine, DDI, anthracycline, FTC, lamivudine, 3TC, stavudine, D4T, tenofovir, TAF, zelcitabine, DDC. The non-nucleotide transcriptase inhibitors include delavodine, efavirenz, atrevirine, ETR, nevirapine, MVP. The nucleotide reverse transcriptase inhibitors are mostly anti-metabolic drugs. Use 3 or more drugs from different drug classes before symptoms appear. It is called HAART, highly active anti-retroviral therapy, shown to reduce or reverse CD4 decreases, shown to reduce morbidity and 5-year mortality. The viral reverse transcriptase is different from mammalian reverse transcriptase. The nucleotide reverse transcriptase inhibitors lack a 3-hydroxyl group on the ribose ring. Next, the nucleotide cannot bind. They are converted by host cell kinases to triphosphates, block binding of nucleotides to the D site of RT, act as chain terminators. All nucleotide reverse transcriptase inhibitors may cause lactic acidosis and severe hepatomegaly. Watch aminotransferase levels closely. The nucleotide reverse transcriptase inhibitors include abacavir, ABC, guanosine analog, good oral availability, and a cell half-life of 12 to 24 hours. Resistance is unlikely, requires several point mutations. Hypersensitivity reactions, occasionally fatal, occur in 5% of HIV patients. Didanosine DDI can reduce dose-based in kidney function. Resistance is unlikely, requires several point mutations. The adverse events include high degree of pancreatitis. Up to 30% of patients develop pancreatitis, so watch carefully for cases. And it has peripheral neuropathy. Emtricitabine (FTC). It has good oral availability, renal elimination, once daily dosing. Contraindicated in pregnancy, children, patients with hepatic dysfunction. Lamivudine 30C, used in HAART for HIV and in hepatitis. The toxicity adverse events include gastric distress, headache, insomnia, fatigue. Stavudine D4T. It has its renal elimination adjusts dose based on renal function. Peripheral neuropathy increase the risk of lactic acidosis, steatohepatitis compared to others. Tenofovir also has TAF also has activity against HBV, may impede renal clearance of acyclovir and ganciclovir. The toxicity includes gastric distress, Fanconi syndrome, headache, insomnia, fatigue. Zelcitabine DDC is distributed to most tissues including the CNS. Renal excretion, dose reduction in renal function, renal disease. Metabolized through cytochrome 450, rifampin increases clearance, so azoles decreases clearance. Toxicity include pancreatitis, esophageal ulcerations, stomatitis, dose-limiting peripheral neuropathy. Zidovudine (ZDV), formerly called azidosamidine (AZT), distributed to most tissues, dual elimination by kidney and liver. Toxicity include bone marrow suppression, anemia, neutropenia, gastric distress, Fanconi syndrome, headache, insomnia, fatigue. Non-nucleotide reverse transcriptase inhibitors binds on a different site than the nucleotide reverse transcriptase inhibitors. Do not require phosphorylation to be activated. No cross-resistance with nucleotide reverse transcriptase inhibitors. If used in monotherapy, resistance occurs rapidly and through a mutation in the POL gene. Dilorvadine drug interactions are a major concern. Blood levels increased by azoles, microlyse. Blood levels decreased by antacid, DDI, phenytoin, rifampin, nafinavir will affect warfarin levels. Toxicity includes skin rash in 20% of patients, pregnancy teratogenic. Efavirenz EFV can be given once daily and metabolized by CYP, and drug interactions are common. Toxicities include neuron, CNS dysfunction, skin rash, teratogenic in first trimester, increases blood cholesterol. Echeverrin, the newest non-nucleotide reverse transcriptase inhibitors, its substrate or inducer of cytochrome C and inhibit 2C9 and 2C90. The toxicity include diarrhea, skin rash, teratogenic in first trimester, increased blood cholesterol, triglyceride, serine transaminases. Nevirapine (NYP), commonly used in three-drug regimen, effective in preventing vertical transmissions. It can induce skin rash for 15 to 20% of patients. Steven-Johnson syndromes, toxic epidermal necrolysis. So the nucleotide reverse transcriptase inhibitors include abacavir (ABC), didanosine (DDI), antricitabine (FTC), lamivudine (30C), stavudine (D4T), tenofovir (TAF), zelcitabine (DDC). The non-nucleotide reverse transcriptase inhibitors include delavodine, efavirenz, echeverrin, nevirapine,